you are on hibernating mode, 90% of your functions are up and running, but you didn't recall any of it. And when you touch the mouse, you switch this computer from hibernating to task active. That's exactly what happens in our minds. 90% of your brain network are functioning up and running, and when you choose to switch into task, you only increase your metabolism of the brain connectivity by 10 to 20%. Therefore, we have two modes of our functional brain connectivity, the task-based connectivity and the resting state connectivity. If we elect to test our brain into the task mode, we will be only testing 10% of its connectivity potential. So how can we test our brain using the resting state functional connectivity? Simply, we apply a certain rule. If a group of neurons are firing together or functioning together, they will have the same bold signal pattern. You see here, this is our sensory motor network. This is the right premotor area, and this is the bold signal from the right premotor area, and this is the right and left sensory motor cortices. Okay, if you pay attention to the panel C here, this is the right sensory motor cortex, and you follow the bold signal fluctuation pattern, you will find that the right sensory motor region was first connected to the left one, then it switched connectivity to match with the right premotor region, then it switched back to the left premotor. All this can be established from the assessment of the frequency and phase and amplitude of both signal. If we repeated the process, if we analyze the bold signal of each functional brain region and correlate it with the other, we will be able to separate the different brain functional region and establish functional connectivity at the resting state pattern. At the resting state, we have 8 macroscale networks, 5 for cognitive function and 3 for the sensory motor function. To switch between the task and the resting state mode of our brains depends entirely on the salience network, which is one of the chief cognitive brain function. If you are not able to concentrate or maintain function, the problem will be in this switch. So how can we, which tool we can use to assess the functional brain connectivity at resting state? We can go with the neurophysiologic tools, of course, but it has a very poor spatial resolution. We can go with the PET, but we will have to have a cyclotron for oxygen water, and it will be a bit invasive and expensive modality. So fMRI represents the optimum balance between the spatial and temporal resolution, cost and availability of a tool to assess the functional brain connectivity. Okay, so if we are going to go MRI, what mode should we operate in? Is it task mode or resting state mode? The resting state functional MRI will take about 6 to 12 minutes only for acquisition, and we do not rely at all at patient cooperation. We can perform it with pediatrics age group, in comatose patient, and even in disabled patient. You cannot do that in the task state fMRI. If the patient is hemiplegic, you cannot test his motor function. If the patient is aphasic, you cannot test his speech function using task state fMRI. Also, given the fact that it has a very little acquisition time and does not rely on patient cooperation, you can use it for emergency workup, like cases of acute hemorrhage in a tumor and conization, etc. Okay. Also, resting state fMRI allows you to examine all the brain function at a single package, while task state MRI will allow you to examine only the task that you performed. If you performed a motor hand function, all what you are getting is a motor hand function. The problem with resting state MRI really will be the analysis. Its analysis is a bit tricky and difficult. But before we go to that, I'd like to review some of its basic clinical applications with you. Task state MRI, resting state MRI has 100% sensitivity compared to electrocorticography in pre-surgical mapping, while task state has only 65% sensitivity. Also, if you have the advanced technique of acquiring EEG simultaneous with the functional MRI, you will be able to study the brain function while the attacks of convulsions occurs, and we will be able to localize the most active brain region, which is the epileptic focus, and the other irritative brain region, and pinpoint it pre to the surgical procedure. Another huge advantage of the functional MRI of the resting state mode that we can use it to assess for developmental and cognitive disorders. We simply create a control maps and we get the patient map and subtract both maps from each other, and we will get where the patient brain is dysfunctioning. Later on, we can use the patient's own map to assess if he is improving on a certain treatment or not. The same concept apply in prognosis of dementia, especially Alzheimer. If we have a high-risk patient, we can perform a baseline fMRI scan to him and rescan him 2 years later and trace the change better in his functional connectivity, especially the posterior cingulate cortex. If this connectivity is dropping in a certain rate, then we predict this patient will definitely develop Alzheimer at a certain point. Another great application to resting state MRI is biopreventing cognitive resistive diseases. Depression is one of the most frustrating conditions to treat, and it is almost the epidemic of the century. 20% of population below 50 years are suffering from certain degree of neuropsychological disorders, and depression at the top of that. The problem with depression, if you didn't get the correct treatment right at the first time, your patient are most likely to develop resistance to treatment. And his chances to get depression-free will decrease with each time you attempt the wrong treatment. If we use resting state MRI, we can pinpoint which area of the brain is suffering from dysfunction, and we can target the treatment to this area, whether by selecting pharmacological agent or by using transcranial magnetic stimulation. So, analyzing resting state fMRI, the most commonly used method is a seed-based method. The rest of the methods are quite difficult, and this is not our place to examine it. Okay, how can we apply seed-based functional connectivity in resting state MRI to check for motor, say, or language function? Here I will demonstrate language function. I will apply ROA to the inferior frontal gyrus. Here I choose the right one. I will separate the bolt signal of this right frontal gyrus. Then I will compare the bolt signal of each other brain function to it. If the correlation or the similarity between the bolt signal of the inferior frontal gyrus and any other brain region is above certain statistical threshold, I will count this region as significant. Okay? We repeat this process across the entire brain. And now we are successfully recreating the language network by assessment of a seed at the right inferior frontal gyrus. Okay, the major trick at the MRI, resting state MRI analysis is obtaining high signal study. Our bread and butter here is analyzing the bolt signal. If you do not have an adequate signal, you don't have anything. Actually, you will have lots of artifacts to study. Okay, how can we increase the signal? Simply by increasing the field strength. You cannot perform, you shouldn't perform resting state MRI at fields less than 3 Tesla. Although the first study was created at 1.5 Tesla, but it only demonstrated the motor function and nothing else. Okay, so first use 3 Tesla to acquire a higher signal and apply lots of tricks to decrease the noise. One of the tricks we use is to segment the source of the noise out of the image. Here we perform brain segmentation and take out the white matter and the CSF segment, including their signal from the image. Here you see this image didn't go any physiologic noise correction. We didn't remove the CSF signal. While in this region, we remove the CSF segment and signal from the image. We have much less noise around the brain center. The most tricky part at the resting state fMRI is correcting for head motion. For head motion, we can do realignment of scan volumes, right? But it won't correct for the effect of noise on the signal frequency. But if I tell you that noise frequency tends to be high, while bolt signal from resting state brain activity tends to be low, we can apply a filter to separate the two signals. Any signal that's below 0.9, I will consider it a resting state signal. That is here the line in black. Any signal that's higher than 0.1 in frequency, I will consider it a noise and separate the two spectrum from each other. If we failed, we will remove the Colbert volume altogether. Okay, back when we said we are creating the speech network from the inferior frontal gyrus raw, we said the keyword is setting a threshold. If you put a very high statistical threshold, we will lose multiple areas of true brain connectivity, and we will have a high false negative error. If we use a very low threshold, you can get a salmon, a dead salmon fish to speak. This experiment was created by Craig Bennett and colleagues at 2009. He put a dead salmon into an MRI scanner and performed a task motor MRI study. And he kept his old thresholds very low. And so he got bold signal activation along with the mouth and the bone of the fish. Okay, so what is the optimum threshold? Nobody knows until this very moment. And it's recommended to use the default statistical thresholds provided by your analysis software. So the take-home message: resting state fMRI is the modality of choice to investigate functional brain connectivity with multiple clinical applications at single subject and group level. Correcting physiologic and head motion-induced noise are of paramount importance to analyzing resting state fMRI. So is choosing the optimal statistical threshold is critical to produce reliable and reproducible resting state fMRI networks. Thank you.
Thank you, Dr. Habiba. Now we will call for Engineer Mohammed Abdel Raouf. Please come to stage, last speaker.